Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs, brought to you by LucidQuest. Advocate Aurora Research Institute has joined the Clarity trial, a pivotal study evaluating Aclarion's Nociscan, an AI-powered tool for diagnosing chronic low back pain. This technology analyzes spinal disc biomarkers to guide surgical decision-making. The trial will enroll 300 patients, randomized to receive either blinded or unblinded results from the AI system prior to spine surgery. Outcomes will be tracked over 12 months to assess pain reduction. Dr. Nicholas Theodore leads the study. If successful, this could significantly improve diagnostic precision and post-surgical outcomes for patients with persistent back pain. A Yale University study reports that combining live music and mindfulness significantly lowers anxiety and depression levels. Among 38 participants monitored through heart rate and EEG sensors, live sessions fostered greater emotional regulation and social connectedness than virtual ones. The approach is both scalable and accessible for community-level mental health interventions. Researchers suggest that this strategy may complement existing therapies for emotional wellness. A study of over 3,300 UK adolescents reveals that teens with clinical anxiety or depression spend approximately 50 more minutes daily on social media than their peers. These individuals report stronger emotional swings tied to likes and comments, and a reduced sense of control during online interactions. The findings highlight the need for targeted digital interventions and further exploration into how social media affects vulnerable youth populations. A meta-analysis of 229 studies confirms that exercise delivers moderate to large effects in reducing depressive symptoms. Aerobic, moderate intensity, and short-duration activities proved most effective. Compared to medication and psychotherapy, exercise offers a side effect-free alternative with comparable efficacy. Researchers advocate for its recognition as a frontline treatment in managing depression, citing its accessibility and broad physiological benefits. Hospitalizations involving cannabis rose by 20% in Arizona between 2016 and 2021. The steepest increase occurred among older adults. Critically, cannabis-related visits were 8 times more likely to involve mental health conditions. With increasing THC potency and the unregulated use of cannabis as a self-treatment for anxiety and depression, experts stress the need for public education and clinician guidance on risks, especially for vulnerable groups. A 2021 study found that many personal care products commonly used by Black and Latina women contain toxic chemicals such as formaldehyde. Participants reported using an average of 17 products daily, many with undisclosed carcinogens. The research highlights racial disparities in chemical exposure, largely driven by beauty standards. Experts are calling for updated FDA regulations, full transparency in labeling, and public awareness to address systemic risks to women's health. A novel AI model has identified a set of gene expression biomarkers in urine that more accurately detect early-stage prostate cancer compared to current PSA blood tests. The study, involving over 2,000 patients, suggests that this non-invasive method could dramatically reduce unnecessary biopsies and improve early diagnosis. Researchers emphasize the need for additional trials, but express optimism about the clinical potential of AI-assisted cancer screening. A study tracking dietary habits and health outcomes in over 7,500 children found that girls who consumed diets rich in whole foods experienced a later onset of menarche. In contrast, diets high in processed meats and added sugars were linked to earlier puberty, which is associated with long-term health risks such as cardiovascular disease and certain cancers. The findings support early nutrition education as a public health strategy to promote healthier developmental timelines. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.